man named Robert. He was 71 years old, a retired school teacher from Ohio, sharp, energetic, and genuinely proud of how seriously he took his health. Every morning without fail, Robert lined up 8 supplement bottles on his kitchen counter. A multivitamin, vitamin D, calcium, fish oil, vitamin C, a joint support formula, a memory booster blend, and a protein shake. His daughter called it his morning pharmacy, but Robert called it his insurance policy. He had read the articles, he had watched the videos, he had done his research, and every single one of those supplements had been recommended somewhere by someone with credentials. For 2 years, Robert felt like he was winning. Then his annual blood work came back. His creatinine levels were elevated, his GFR, the number that measures how well your kidneys are actually filtering your blood, had dropped significantly. His doctor referred him to a nephrologist. The diagnosis was chronic kidney disease, stage 2, caught early enough to manage, but not early enough to reverse completely. Robert was devastated. He had not been eating badly. He had not been drinking. He had not been taking prescription medications known to harm kidneys. He had been taking vitamins. And here is the part that should make every person over 65 stop and think. When Robert's nephrologist reviewed his supplement list, she identified 4 of his 8 daily supplements as direct contributors to the kidney, stress showing up in his labs. 4 out of 8. All of them available over the counter. All of them marketed as health products. None of them labeled with a warning that said, talk to your doctor before taking this if you are over 65. My name is Dr. Franklin, and this channel exists for one reason: to give adults over 60 the information. The system does not always make time to deliver. Today I am walking you through 6 of the most commonly taken vitamins and supplements that, after the age of 65, carry a real and documented risk of kidney damage that most people taking them have never been warned about. Before we go any further, I need to say something clearly and I need you to hear it. I am not telling you to stop your supplements. Please do not stop anything abruptly without speaking to your physician or pharmacist first. Some of these supplements interact with medications. Some require gradual tapering. What I am giving you today is information and awareness, because an informed conversation with your doctor is always more powerful than silence. Stay with me through all 6, because number 1 is not a supplement most people would ever suspect. It is something millions of seniors take every single day, specifically because they were told it. Protects their health, and the research behind what it does to aging kidneys is something I wish more. Drop a comment right now. How many supplements do you take every day? Alright, supplement number 6. This one surprises people every time because universally trusted supplement in existence, grandmothers recommend it. It has been associated with immune support, skin health. So what is the problem? And the problem is what happens to excess vitamin. When your body metabolizes vitamin C in a younger, fully functioning kidney. After 65, kidney filtration capacity naturally declines, roughly 1% of kidney 40. By 65, kidneys that are operating at 70, that is normal aging. When oxalate accumulates faster than aging kidneys can clear it, 2 things happen. A condition called oxalate nephropathy, second stone, which are significantly more prevalent in adults over. A 2019 study in the clinical, nephrology followed over 156,000. High-dose vitamin C supplementation was associated with A, formation unmeasurable. The critical word here is dose. C in adults is 75 to 90 milligrams per day, 500 to 1,000 milligrams per tablet. Requirement in a single pill, what to do instead. Testing your oxalate levels and high-dose vitamin C. If whole food sources of vitamin C, broccoli, citrus, fiber, and phytonutrients, if you supplement, formulation of 100 to, rather than the megadose bottles that supplement number 5. Here is one that will genuinely challenge, possibly by your own doctor. Tell me, are you over 65? I read every comment and your answer might help someone else watching this today. Number 6, vitamin C in high doses. Vitamin C is perhaps the most. It is in every grocery store, every pharmacy, every health food aisle. Doctors recommend it. An antioxidant protection for decades. The problem is dose. C inside the body after the age of 65. It converts a portion of it into a compound called oxalate. Oxalate is filtered out of the blood and excreted efficiently in urine. The average person loses function per year after the age of, you may be working with, to 75% of their peak capacity. But it changes how your kidneys handle oxalate. First, oxalate crystals can form and deposit in kidney tissue, which causes direct structural damage to kidney cells. Those same crystals are the primary building material of the most common type of kidney, calcium oxalate stones 65 than in younger populations. Journal of the American Society of Adults and found that regular, defined as 1,000 milligrams or more per day, significantly elevated risk of kidney stone, decline in GFR in adults over 60, the recommended dietary allowance for vitamin. Most supplement bottles contain, that is up to 13 times the daily, taken casually every morning. Talk to your doctor about kidney function before continuing. You want immune and antioxidant support. Bell peppers, strawberries, deliver the nutrient alongside that naturally regulate absorption. Consider a low dose 250 milligrams. Dominate the market. Calcium supplements, something many of you have been after menopause and with advancing age. The logic is simple. You are losing bone density. The problem is what happens to in aging blood vessels and aging, different from what happens with when you consume calcium through food, through the digestive system where it goes in the body, particularly calcium carbonate, the most common form. Aging kidneys that are already operating struggle to process this load efficiently. Is a condition called hypercalciuria, which dramatically increases calcium phosphate kidney stones, including kidney tissue itself, which causes progressive structural kidney damage. Meta-analysis published reviewed data from over that calcium supplementation was associated with a 17. Risk of kidney stone formation, stress in adults over 65, dietary calcium, the calcium you get from dairy, does not carry this same risk. The risk is specific to the supplement form. Ask your doctor to test your actual calcium levels and your vitamin. Many older adults who supplement calcium, and the supplement is creating excess. If supplementation is medically necessary, then calcium carbonating carries, and always take calcium with adequate magnesium. If you are still with me on finding this valuable, it tells me you are watching and it helps this information supplement number 4. This one lands differently, protein intake in, and the science behind it is real. Adequate protein genuinely helps preserve muscle mass, strength, and independence. Calcium supplementation has been almost universally recommended for bone health. Bones need calcium. Take calcium. Supplemental calcium, kidneys, that is fundamentally dietary calcium from food. It is absorbed gradually. Alongside other minerals that regulate, when you take a calcium supplement, it delivers a concentrated bolus of calcium into your bloodstream rapidly. Below peak capacity, the result in a significant subset of older adults, excess calcium in the urine, the risk of calcium oxalate, and long-term, the calcium that does not get excreted can deposit in soft tissue in a process called nephrocalcinosis. A comprehensive 2021 in the British Medical Journal, 500,000 adults, and concluded, as opposed to dietary calcium intake, percent increased, and a measurable increase in markers of kidney. And here is the important nuance. Leafy greens, almonds, and sardines. In fact, dietary calcium appears to be protective against kidney stones. What to do instead? D levels before continuing supplementation. Already have adequate levels. If you genuinely need calcium support, prioritize dietary sources first. Calcium citrate is absorbed more gently, a lower kidney risk profile, which helps regulate where calcium is deposited in the body. Type the number 5 in the comments right now. Reach more seniors who need it. Protein powders and high-dose protein supplements. Because the push toward higher. Seniors is everywhere right now. After 65, muscle loss, called sarcopenia, accelerates. What I'm asking you to consider is the delivery mechanism. Your kidneys are the primary organs responsible. Products of protein metabolism. It produces nitrogen waste compounds. In healthy young kidneys, these are filtered and excreted efficiently. Of their function through normal aging, the kidneys are forced to work. Ordered to keep up with the nitrogen, over time chronic glomerular, progressive scarring of the kidney's filtering units. The glomeruli, a 2020 study in the Journal of the Adults over 65 consuming more than of body weight daily showed 3-year observation, moderate protein levels. Popular protein shakes deliver 25 to 50 grams of protein per serving. They may be significantly kidneys can handle comfortably. Many contain added artificial sweeteners, which preliminary research suggests may, through gut microbiome disruption, additionally independent testing, powders contain trace amounts of heavy metals, which accumulate in kidney tissue over time with chronic exposure. Prioritize whole food protein sources. Greek yogurt, nutrients that support. If you use protein supplements, daily protein target for your, and if you do supplement number 3, creatine. Creatine has genuinely strength and cognitive function in older adults. What I am doing is giving you the complete and the dose for filtering the waste when your body breaks down protein, including urea and creatinine. In kidneys that have lost 25 to 30%, a chronic high protein load creates a condition called glomerular hyperfiltration, harder than their capacity comfortably allows in. Waste load, hyperfiltration causes, accelerating the very kidney decline that aging has already begun. American Society of Nephrology found that 1.5 grams of protein per kilogram, measurably faster GFR decline over a period compared to those consuming many. If someone is having 2 shakes per day on top of dietary protein, exceeding the threshold, they're aging. There is a second concern with commercial protein powders specifically, particularly sucralose and acesulfame potassium, contribute to kidney stress and systemic inflammation, has found that some protein, including lead and cadmium, what to do instead. Eggs, fish, chicken, legumes, which deliver protein alongside, rather than stress kidney function. Speak with your doctor about the right total, specific kidney function level. Choose products with third-party testing certification and minimal additives. I want to be careful here because impressive research behind it for muscle, I am not dismissing that science. Picture that the supplement marketing rarely includes creatine is metabolized in the body into creatinine. When you take creatine supplements, your blood creatinine levels rise. But here is the clinical problem it creates for adults over 65. Kidney function decline on routine blood tests. But because the elevation could be from the supplement rather than from actual kidney, The signal gets confused. Disease can be missed or delayed in. Marker is being artificially influenced. Review in nutrients found that in adults with pre-existing mild to moderate, which is extremely common and often undiagnosed in adults over 65, accelerated filtration decline, baseline kidney function. Many seniors begin creatine supplementation without ever having had a kidney function. They do not know whether their kidneys are already compromised. That directly stresses kidney, markers that would alert there, what to do instead. Ask your doctor for a complete kidney function panel, including GFR, if your kidney function is fully normal, creatine at 3 grams per day rather than the 5-gram loading doses common in sports. Regular monitoring every 6 months is essential. This is a conversation that needs to happen with your nephrologist before you begin. It genuinely helps me understand who is watching and what topics to cover next. Vitamin D in high doses. Deficiency is genuinely common in adults over 65 and genuinely harmful. Immune dysfunction, depression, supplementing vitamin D, which is one of the primary markers your doctor uses to assess kidney function. This is not automatically a sign of kidney damage. Elevated creatinine from creatine supplementation can mask genuine. Your doctor looks at your creatinine level and sees a number that suggests kidney stress, damage, genuine early kidney diagnosis because the lab. Additionally, a 2022 kidney impairment creatine supplementation compared to non-users with similar. The critical point, baseline established, and they are adding a supplement. Filtration and obscures the very lab doctor to a problem. Before starting creatine in bone and urine albumin, low dose, nutrition may offer benefit with lower kidney stress. And if your GFR is already below 60, type the number 3 in the comments if you are following along. Supplement number 2. Now this one is deeply important because vitamin D, low vitamin D, is linked to bone loss and cognitive decline. When you are deficient, is medically appropriate and beneficial. The problem is what has happened culturally around vitamin D over the past decade. Bottles of 5,000 IU are widely available and widely taken without medical supervision. Does to aging kidneys is something far too. Vitamin D is fat soluble. Fat soluble vitamins accumulate in body tissue. It causes a condition called mechanism of kidney damage from vitamin. Excess vitamin D drives aggressive calcium from bones into the bloodstream. The same calcium overload problem but amplified, including calcium deposits in kidney tissue and accelerated GFR decline. And the insidious part is that the symptoms of early vitamin D toxicity, frequent urination, universally attributed to other causes, or a 2021 study in JAMA, adults over a 3-year period, IU or more of vitamin D daily, additional bone or immune 400 IU, higher rates of kidney stone formation. It has become a megadose supplement, 10,000 IU, even 50,000 IU. And the research on what chronic high-dose vitamin D, few people taking these supplements have ever seen. Unlike water-soluble vitamins that your body excretes when levels rise too high, when vitamin D accumulates to toxic levels, hypervitaminosis D, the primary, D toxicity is hypercalcemia, elevated blood calcium. Absorption from the gut and releases your kidneys then face, discussed with calcium supplements. The resulting kidney damage can be severe. Fatigue, nausea, increased thirst are so non-specific that they are almost simply to aging itself. Internal medicine tracking over 400 found that those taking 4,000 without confirmed deficiency showed no benefit compared to those taking, but showed significantly and elevated calcium markers. What to do instead? Level tested before, doctor rather than self-dosing, with genuine deficiency need between, daily to reach optimal levels. It is potentially dangerous. Every 6 to 12 months to ensure supplement number 1. I told you at the beginning that number 1 would not be what you expected, because this is not a single supplement, and it may be the most quietly in the supplement cabinets of seniors. Walk into any pharmacy or health food store, marketed specifically at seniors. Joint health formulas, prostate support, they have reassuring names. They carry claims like clinically studied ingredients and doctor formulated. Proprietary blends actually contain at what doses with each other, and which of those ingredients have documented nephrotoxic. Let me give you specific examples. Is one of the most potent kidney toxins ever identified to a form of rapidly progressive aristolochic acid nephropathy. But contamination of herbal products remains a chromium picolinate, has been linked in multiple studies to oxidative. Get your 25-hydroxy vitamin D, supplementing and set a target with your most adults over 65, 1,000 and 2,000 IU. More is not better. And retest your levels. You are not accumulating toward toxicity. Herbal supplement blends and multi-ingredient proprietary formulas. And I meant it. This is a category. Dangerous thing sitting across this country right now, and you will find walls of products, memory support blends, energy boosters, immune defense complexes. They have photographs of healthy, active seniors on the labels. What they almost never tell you is how those ingredients interact, and with common prescription medications, meaning kidney toxic, effects in older adults. Aristolochic acid, found historically in some traditional herbal preparations, directly linked to kidney failure called. Regulatory agencies have banned it in many formulations. Documented problem in unregulated markets. Found in many blood sugar support and weight management supplements. damaging kidney tubule cells with chronic use in older adults. High-dose licorice root found in adrenal support and stress relief blends, directly stressing kidney filtration over time, and several other botanicals. Documented associations with kidney stress that most, and here is the most dangerous part of all, was not taking any of these individual ingredients knowingly, support formula and a memory, as part of proprietary ingredient lists printed, the supplement industry in the united framework that does not, the way prescription medications do. For aging kidneys, in lab results that get attributed to age rather than to the product on the shelf, take every supplement doctor or pharmacist appointment. Ask specifically whether any with your current prescriptions. Health, which maintains a free and approach, blend, and vague ingredient. Now here is what ties all 6 of these together. None of these supplements is automatically dangerous for every person. He was harmed by the cumulative load, 4 of which were stressing his kidneys. His kidneys were managing one insult reasonably well. Raises blood pressure through aldosterone pathway activation. Thundergod vine willow bark found in joint support formulas have. Users have never been warned about. Robert, the man I told you about at the beginning of this video, he was taking a joint booster blend that contained several of them. In font so small he had never read them carefully. States operates under a regulatory, require pre-market safety testing. A supplement can be sold until evidence of harm accumulates. That evidence often accumulates slowly, quietly. What to do instead? Bottle you currently use to your next. Ask them to review the full ingredient list, not just the headline nutrients. Ingredients are nephrotoxic or interact. Use a resource like the NIH National Center for Complementary and Integrative, evidence-based database of supplement safety profiles. Any product with a proprietary doses with genuine caution, the same pattern we have seen in other videos on this channel. Robert was not harmed by any single bottle. 8 supplements. Through different mechanisms simultaneously. They were not designed to manage 4 at once, every single day for 2. The medical term for this is polypharmacy, but it applies equally to supplements. Most of the seniors experiencing will never connect the dots. Decline in GFR. The supplements will never be questioned because they are not medications. They are natural. Here's your practical framework. First, bring every supplement you take, every protein shake label, to run a complete kidney function panel if one. This includes GFR, serum creatinine, BUN, which is an early and sensitive marker of kidney stress. Which of these supplements do I actually need? And which ones can I get from food instead? They do not send pain signals in the early stages. It has often been progressing quietly for years, and the supplement review is the conversation. Something has already gone wrong. He worked with his nephrologist and his routine to 3 evidence-based doses with regular monitoring. It did not fully recover, but it stopped declining. The trajectory would have been significantly worse. Every person's kidney function, medication list, and health history is different. Armed with the right questions, if this video gave you something new to think about, please subscribe. Evidence-based, honest and built who deserve real information. And leave a comment below. Have you ever had your kidney function tested? Someone else watching today needed to hear before. Take care of yourselves. And the tragedy is that early kidney stress from supplement overload, their labs will show a gradual. Doctor will note it and monitor it. They are vitamins. They are health products. Before your next doctor appointment, do 3 things. Every bottle, every packet. Second, ask your doctor. Has not been done in the past year. And a urine test for albumin. Third, ask directly, given my age and my kidney function, which ones have documented kidney risks. Your kidneys do not announce when they are struggling. By the time you feel kidney disease, the lab test is the only early warning system you have, that most people never have until Robert made those changes. Primary care doctor to simplify his supplement, products that appropriate, his GFR stabilized. His nephrologist told him that had he continued for another year without catching it, I cannot promise you Robert's outcome. What I can promise you is that an informed conversation with your doctor is always more powerful than silence. I make videos like this every single week, specifically for adults over 60 about their own bodies. How many supplements are you currently taking? Your answer might be exactly what? Their next lab appointment. I will see you in the next one.